हेलो एवरीवन, आज न्यू चैप्टर रेस्पिरेटरी पेपर 3 शुरू करते हैं। इसका फर्स्ट क्वेश्चन है द मोस्ट इम्पॉर्टेंट मसल ऑफ एक्सपायरेशन आर ए डायफ्राम, बी एक्सटर्नल इंटरकॉर्टेक्स, सी इंटरनल इंटरकॉस्टल, डी एब्डोमिनल वॉल मसल्स। तो राइट ऑप्शन इज डी एब्डोमिनल वॉल मसल। नेक्स्ट है cavernous breathing is seen in A. pleural effusion, B. consolidation, C. CA lung, and D. cavity lung. Right option is D. cavity lung. Next question is Monday dyspnea is seen in A. bassinosis, B. pulmonary eosinophilia, C. malingering, and D. chronic bronchitis. Right option is A. bassinosis. Next question है pleural calcification is seen commonly in A. silicosis, B. asbestosis, D. hyperparathyroidism, and D. bronchogenic carcinoma. Right option is B. asbestosis. Next question is the hallmark of generalized obstructive lung is reduced A. tidal volume, B. timed vital capacity, B. vital capacity, and D. residual volume. Right option is B. timed vital capacity. Next question is commonest cause of respiratory failure type 2 is A. pleural effusion, B. chronic bronchitis with emphysema, C. bronchiectasis, and D. aspergillosis. Right option is B. chronic bronchitis with emphysema. Next question is bovine cough is characteristic of A. acute epiglottis, B. tracheitis, C. laryngeal paralysis, and D. chronic laryngitis. Right option is C. laryngeal paralysis. Next question is crackling crepitation unaltered by coughing is characteristic of A. pulmonary tuberculosis, B. interstitial lung disease, C. Klebsiella pulmonea, and D. lung abscess. Right option is B. interstitial lung disease. Next question is commonest site of lung abscess is A. posterior segment of right upper lobe, B. lingula, C. posterior segment of left lower lobe, and D. posterior segment of right lower lobe. Right option is A. posterior segment of right upper lobe. Next question is bronchial asthma is associated with raised level of A. leukotriene, B. PGI, C. PGI1, and D. thromboxane. Right option is A. leukotriene. Next question is silent chest is seen in A. very severe asthma, B. chronic bronchitis, C. emphysema, and D. bronchiectasis. Right option is A. very severe asthma. Next question is in hemoptysis blood usually come from A. bronchial vein, B. pulmonary vein, C. bronchial artery, and D. pulmonary arteries. Right option is C. bronchial arteries. Next question is Monday chest tightness is symptom classically seen in A. basilosis, B. anthracosis, C. berylliosis, and D. bassinosis. Right option is D. bassinosis. Next question is most likely precursor to bronchiectasis is A. tuberculosis, B. carcinoma, C. bronchial adenoma, and D. bronchopneumonia. So right option is D. bronchopneumonia. Next question is asbestosis causes which of the following? A. apical nodular fibrosis, B. Cohen shadow, C. hilar lymphadenopathy, and D. basal peribronchial fibrosis. Right option is basal peribronchial fibrosis. Next question is pneumothorax could be complication of A. staphylococcus pneumonia, B. pneumococcal pneumonia, D. Klebsiella pneumonia, and D. viral pneumonia. Right option is A. staphylococcal pneumonia. Next question is hypercapnia at rest is most indicative of A. hypoventilation, B. right to left shunt, C. impaired diffusion, and D. CO poisoning. Right option is A. hypoventilation. Next question is pleural fluid low in glucose is seen in all except A. rheumatoid arthritis, B. tuberculosis, C. mesothelioma, and D. emphysema. Right option is B. tuberculosis. Next question is anatomical dead space of normal lung is A 150 ml, B 250 ml, C 300 ml and D 350 ml. Right option is A 150 ml. Next question is commonest cause of bronchopleural fistula is A carcinoma bronchus, B bronchiectasis and C pulmonary TB and D bronchitis. The right option is C pulmonary TB. Next question is bronchopneumonia due to measles occur due to A sinusitis, B immunomodulation, C bronchial obstruction and D respiration. The right option is B immunomodulation. Next question is pneumococcal formation is seen in A staphylococcus pneumonia, B staphylococcal pneumonia, C pneumococcal pneumonia and D hemophilus pneumonia. The right option is A staphylococcal pneumonia. Next question is hypersensitivity pneumonitis is associated with A hilar lymphadenopathy, B raised IgE, C raised serum precipitants, D increased eosinophils. So right option is C raised serum precipitant. Next question is which pulmonary function change is seen in COPD? A decrease residual volume, B decrease FEV, C decrease mid expiratory flow rate and D decrease diffusion capacity. Right answer is A decrease residual volume. Next question is pneumonia is not a complication of A mumps, B varicella, C cytomegalovirus and D measles. Right option is D measles. Next question is regarding tuberculous pleural effusion. All are correct except A hemorrhagic fluid, B increased mesothelial cell in pleural fluid, C pleural fluid has LDH less than 60% of serum LDH, D decreased ADA level. Right option is B increased mesothelial cell in pleural fluid. Next question is allergic bronchopulmonary aspergillosis complicates A tuberculous cavity, B pneumoconiosis, C bronchiectasis and D bronchial asthma. So right option is D bronchial asthma. Next question is respiratory alkalosis occur in A excessive ventilation, B pyloric stenosis, D diabetic ketoacidosis and D primary hyperaldosteronism. The right option is A excessive ventilation. Next question is bronchiectasis is most common in which lobe? A right upper lobe, B right middle lobe, C left upper lobe and D left lower lobe. Right option is D left lower lobe. Next question is all are seen in ARDS except A pulmonary edema, B hypoxia, C hypercapnia and D stiff lung. Right option is C hypercapnia. Next question is presence of cholesterol crystal in pleural effusion is feature of A myxedema, B hypertriglyceridemia, C hypothyroidism and D sarcoidosis. Right option is A myxedema. Next question is type of lung carcinoma producing superior vena cava syndrome. A squamous cell carcinoma, B adenocarcinoma, C small cell carcinoma and D anaplastic carcinoma. So right option is A squamous cell carcinoma. Next question is most common cause of emphysema is bronchopleural fistula, B tubercular pneumonia, C bacterial pneumonia and D pleurisy. Right option is C bacterial pneumonia. Next question is right hemothorax with right side shift of mediastinum is due to A collapse of lung, B right side pneumothorax, C hydrothorax and D bronchiectasis. Right option is A collapse of lung. Next question is pleural aspiration with raised LDH and amylase seen in A. Pulmonary infarction, B. COPD, and C. Pulmonary malignancy, and D. None. Right option is C. Pulmonary malignancy. Next question is complication of bronchiectasis include all except A. amyloidosis, B. lung abscess, C. cerebral abscess, and D. bronchogenic carcinoma. So right option is D. bronchogenic carcinoma. Next question is which hepatic venous pressure represent the pressure in the A. main portal vein, B. main hepatic vein, C. central vein radicals, and D. sinusoids. Right option is A. main portal vein. सॉरी फ्रेंड्स, ये 5 क्वेश्चन पहले आ गए हैं, नंबरिंग में थोड़ा गड़बड़ हो गया है, प्लीज़ चेक कर लीजिए. नेक्स्ट क्वेश्चन इज द फॉलोइंग डज नॉट अकर विद एस्बेस्टोसिस. ए. मिथेमोग्लोबिनीमिया, बी. न्यूमोकोनाइकोसिस, सी. प्लूरल मेसोथीलियोमा, डी. प्लूरल कैल्सिफिकेशन. राइट ऑप्शन इज ए. मिथेमोग्लोबिनीमिया. नेक्स्ट क्वेश्चन इज अर्लीस्ट एविडेंस ऑफ क्लबिंग इज ए. increase AP diameter, B. shine, C. fluctuation, and D. increase transverse diameter. Right option is C. fluctuation. Right. Next question is bulging fissure sign and characteristic of pneumonia due to anaerobic bacteria, B. mycoplasma, C. pseudomonas, and D. Klebsiella. So right option is D. Klebsiella. Next question is sinobronchial infection is commonly seen in A. pneumoconiosis, B. Carter-Jenner syndrome, C. uremia, and D. Down syndrome. So right option is B. Carter-Jenner syndrome. Next question is bronchial hyperplasia may be caused by all except A. smoking, B. theophylline, and C. prematurity, D. allergy. Right option is B. theophylline. Next question is bronchial adenoma commonly present as A. recurrent hemoptysis, B. cough, C. dyspnea, and D. chest pain. Right option is A. recurrent hemoptysis. Next question is thickening of pulmonary membrane is seen in A. asthma, B. emphysema, C. bronchitis, and D. skeletal defect. Right option is A. asthma. Next question is pneumocytosis. Carinii pneumonia is diagnosed by A. interstitial pneumonia, B. eosinophilia in septa, C. alveolar type 1 cell damage with eosinophils, and D. all. So right option is A. interstitial pneumonia. Next question is true about interstitial fibrosis. A. FVC decrease, B. FEV1 and FVC normal increase, C. FRC normal, and D. FEV1/FVC decrease. So right option is B. FEV1/FVC normal increase. Next question is most common tumor of interior mediastinum tumor is A. thymoma, B. lymphoma, C. neurogenic tumor, and D. vascular cyst. Right option is A. thymoma. Next question is the most common cause of acute cor pulmonale is A. pneumonia, B. pulmonary thromboembolism, C. chronic obstructive pulmonary disease, and D. pulmonary spontaneous pneumothorax. Right option is pulmonary thromboembolism. Next question is A. high amylase level in pleural fluid suggests a diagnosis of A. tuberculosis, B. malignancy, C. RA, and D. pulmonary infection. So right option is B. malignancy. Next question is non-metastasis manifestation of CA lung are all except A. Cushing syndrome, B. diabetes mellitus, C. carcinoid syndrome, and D. hyperkalemia. Right option is B. diabetic mellitus. Thank you so much.